Hi, I'm Dr. Polly Watson, founder of Hormone Wellness MD. This portion of Libido Rescue is about the big O. So many women come into my practice concerned with their orgasms. Maybe they're not as strong as they used to be, maybe they don't happen as often as they used to, or maybe they just take a really long time to get there. So this portion of the class, we're going to look at common reasons why orgasmic function diminishes and offer some solutions about what you can do to make it back to where it used to be, or maybe better. So the first of this group of reasons would be cardiovascular disease. And we see this often in folks who have diabetes and high blood pressure and other medical problems that would cause problems with blood vessel health. So if you're having orgasmic function sort of out of nowhere, it may be a time to sort of check in and make sure that your blood pressure is okay and your blood sugar is normal and that we're not missing another problem. The second area is nerve problems, and those kind of go with cardiovascular disease. We also see nerve problems in folks who do a lot of cycling or spinning. If they're having a lot of compression of their genitals up and down on that hard bike seat, that actually can cause nerve damage, and some women will have sexual side effects from that. So looking at your behaviors is another area that's important. The last area may not be on many people's radar, and that's the health of your pelvic floor muscles. Now, our pelvic floor helps us stand up and have balance. It helps us remain continent and not have an accident. We use it all the time without thinking about it. So many of us are under so much more stress these days. We may be holding tension in our pelvic floor and not even really aware of it. I see this a lot in women who clench their jaw or grind their teeth at night. Maybe they're holding their diaphragm really tight and they're not taking big, deep diaphragmatic breaths. And oftentimes these folks often have really tight pelvic floors. So what has to happen to have an orgasm? One thing that has to happen is a big old muscle contraction, right? And if someone's pelvic floor is already really tight and they need to have a further muscle contraction, there's nowhere for it to go versus a nice long lean muscle that has plenty of space to contract. In this class, we'll address some common clues that might tip you off that you should have your pelvic floor evaluated and offer some solutions for the problem. We'll address using topical vasodilators to help get more blood flow to the genitals and improve orgasmic function, as well as herbal therapies that systemically improve blood flow to the genitals. We'll correct some misconceptions about women's orgasmic function, especially how long normal is. Just a hint, it takes a lot longer in real life than it does in the movies. So the theme of this section is to help you identify potential causes of orgasmic dysfunction and help point you in a direction so that you can get to the root cause of the problem and help find the right solution for you. I hope you will join me for this portion of Libido Rescue and get the pleasure you deserve.